Hi, my name is Scott Fudemberg. I'm a member of the Glaucoma Service here at Wills. And first of all, I want to thank Rita Stern and all the volunteers whose hard work make this event possible and a success year after year. And I want to thank all of you for coming out on this beautiful fall day to share our interest in glaucoma. There's so much about glaucoma and about the way the eye works that's fascinating and important, but we don't really get to talk about during an office visit. And you may often hear, if you have glaucoma or a friend or family member has glaucoma, about visual fields. Many of the times that we mention visual fields in the office, what we really mean is the visual field test. What I'm more interested in today is that which is tested by the visual field test. Actually, your visual field, your vision, and how the eye works and why the vision is the way it is and how it's affected by glaucoma. So first of all, the visual field itself is actually, when you define it, all the points of the physical environment that one can perceive by a stationary eye at a given moment. It's basically everything that you can see. And the classic quote about visual field from a very famous ophthalmologist in Scotland is that the visual field is like an island of vision surrounded by a sea of blindness. But the visual field is divided into the central vision and the peripheral vision. And these divisions are very important. The central vision is the middle part of the visual field. It's the area that helps you see with the most clear detail, and it's the area you use for activities that require fine, sharp, straight-ahead vision, like reading and driving. In contrast, the peripheral vision is our ability to see objects and movement that are outside the direct line of our central vision. But the peripheral vision is characterized by poor detail. It's much more sensitive for light and for movement, and it does help us with our color vision. So why is it that the visual field is divided into the peripheral and the central vision? The reason is because the form of the eye follows its function in this case. If you look at an eye, and if you could peek inside of it, if you looked at this circle that's right in the back, that circle is on a part of the retina called the macula. The macula is right in the center of the retina, and the retina is like the film of the camera, if you think of the eye like a camera. It's located in the back of the eye, and it collects visual information and then transmits that information through the optic nerve back to your brain so you can see. This is an actual picture of a retina, and if you notice, the margins of this picture are scalloped, and the reason is that because the eye is round, we can't take just one picture of the entire retina. So what we sometimes do instead is take many different pictures and stitch them together to get a single flat image that shows us the extent of the retina. And the retina looks orange when we see it in the office, and these red lines here are actually blood vessels that are supplying blood to and from the retina. And this yellow disc in the center is the optic nerve. At least it's the most anterior or forward part of the optic nerve that we can see when we examine the eye. And that optic nerve is actually the front end of a cable that connects the eye with the brain and carries the visual information. Right in the center of the retina is the area called the macula, and that's the area that serves the central vision, that vision that you use for straight-ahead, detailed vision. Excuse me. But right in the center of the retina, where you can see that little bit of a discoloration, is the fovea. And the fovea is the part of the eye that serves your 20/20 vision. So the center of the retina serves your most detailed vision, but that superfine detail, that 20/20 vision, comes from a very small area in the center of the retina called the fovea. So if you measured the surface area of the retina and you compared it with the surface area of the United States, you would find that proportionally the size of the macula in the center of the retina is roughly equal to the size of the state of Kansas, which is right in the center of the map of the U.S. And just to give you some extra perspective on how small that area is that serves your 20/20 vision, proportionally, that's more like the size of your backyard. So the area that serves our 20/20 vision is a very highly specialized and small area of tissue in the back of our eye. Some ocular conditions affect the macula, that area of the retina that serves the best central vision specifically. And the one you will most often hear is age-related macular degeneration or macular degeneration. That's a breakdown in the tissues that separate the retina from the rich network of blood vessels that underlies it. And when you get a breakdown in those tissues, sometimes you can get new blood vessel growth and bleeding underneath the retina. And if you look at this picture, you can see how the macula in this patient with macular degeneration has some red here, which is bleeding. That results in a loss of the central vision. So if you look at a picture of these two buddies right here, if you had macular degeneration which had robbed you of your central vision, it would eliminate your ability to see right in the center of your visual field, while still leaving you able to pick up information about areas outside the center of your visual field. In contrast, glaucoma is a peripheral vision disease. And when it affects the vision, most commonly, but not always, it affects the area of the peripheral vision and it leaves that best central vision until the very end stages of the disease. So people who lose vision from glaucoma, and a lot of vision from glaucoma, might still be able to see with very fine detail in the center of their visual field. Why is this? There are a couple different kinds of photoreceptor cells, which are the cells in the retina that actually pick up the light signals and transmit them into information that's carried back to your brain. The cones are the cells that we use to perceive fine detail. And they're not as sensitive to light, but they're very helpful for detailed vision. And although they're located all throughout the retina, they are most predominant in the area of the macula, in the area of the central retina, and serve your central vision. And by contrast, the rods are photoreceptor cells that don't help us a lot with detail and color, but they're very sensitive to light and to movement. And they are the predominant cells in the periphery of our retina and serve our peripheral and night vision. Interestingly, not all animals are built the same way as humans. There are other animals that may have an even greater need for detailed peripheral vision and night vision than we do. And the structure of their eyes facilitates their ability to see better at night and with their peripheral vision. So if you take, for example, cats or rabbits, they have an iris that moves differently from ours. The iris is the colored part of your eye, in the center of which is a black hole called the pupil. Light goes through that pupil and into the back of your eye. And in response to lighting conditions, that pupil may enlarge or shrink in order to restrict or facilitate the flow of light into the back of your eye. But our pupil is not nearly as able to dilate or expand to let light in as the pupil of some animals like a cat. So if you look at these two pictures, a constricted cat's pupil, and you can see that classic cat's eye shape, which is different than our own, can then be dilated hugely, so that much more light can be let into the eye, much better peripheral and night vision for animals who have a different iris structure than we do. Also, some animals, particularly animals that are nocturnal and spend most of their waking hours at night, need better night vision than we do, and they need better peripheral vision. And so they have a special layer in their retina that we don't have that's called the tapetal membrane. And when light strikes the eye, it's reflected off of that tapetal membrane back through the retina. So they get a second chance to see that light. The light comes through the first time and then is reflected back through the retina again. And that helps these animals see much better at night than we do. And it also explains why when you see animals at night, the reflection of their eyes is so vivid from the headlights of your car, because you are also seeing the reflection of the light off of the tapetal membrane in their eyes. Peripheral vision can be tough to test. So measuring the central vision is much easier because that's your fine detailed vision. We can have you read letters on the wall and we can count how many letters you read and how small the letters are that you're able to read, and that helps us get a measure of your vision. But if you really focused your eye dead ahead and you didn't move your eye at all, you can't read letters with your peripheral vision because you don't have enough detail in your peripheral vision. So that has required us to come up with another way to test the peripheral vision so that we can identify changes in conditions like glaucoma that affect that peripheral vision. Visual fields are critically important. Visual field tests, are critically important because they can help identify change in the visual field before one can actually recognize that that change is occurring. So there's redundancy in the system. You have two eyes, not one. So if the visual field is affected in one eye, your other eye may also be able to perceive some information in that visual field, so you may not even notice if only one eye is affected that you've lost peripheral vision. When people lose that fine detail central vision, it's often very obvious. But peripheral vision loss can be subtle, and that's part of the reason that it's so critical we have good tests to measure peripheral vision. And also, glaucoma is not the only condition that affects the peripheral vision. There are other conditions that are very important and can be diagnosed by measuring changes in the peripheral vision. So when we measure vision, we measure the straight-ahead central vision with eye charts like the Snellen acuity chart. Or particularly if you have retinal problems like macular degeneration, you may be familiar with the Amsler grid, where we are looking for changes in central vision that might be as subtle as just wavy lines. Whereas with peripheral vision, we often test by a couple methods. One is by facing an examiner and keeping one eye closed, we can measure your peripheral vision by what we call confrontation, where a simple target is shown, like a hand or some fingers, and that can give us a rough estimate of whether or not the visual field has been affected. That's a rough visual field test, and it's easy to do. But we have much more sophisticated equipment, like automated visual field machines, which if you have glaucoma, you're probably painfully familiar with. The automated field machines use very sophisticated computer programs and mathematical algorithms to try to get us as good a measure of your peripheral vision as we possibly can, despite the limitations that the peripheral vision is not detailed and can be very hard to test. And although I didn't want to focus on the visual field test, because I think in the office you have opportunities to talk about the test and your results with your doctor, just to give you a rough idea of some of the findings we see in glaucoma on the visual field test, some of the patterns in which glaucoma causes visual field loss. This is a completely normal visual field. And you'll notice that most of it is white, but that there's a black spot. And that black spot is your normal blind spot. The reason you have a blind spot is that's the area where the optic nerve enters the back of the eye. And there are none of those cones and rods, none of those photoreceptors in the optic nerve to help you see. They're all located in the retina. So there's a little area of blindness which is reflected by dark colors in the visual field that's structurally related to the position of your optic nerve. But the rest of this visual field is not darkly colored. It's light, and that indicates this person has a full visual field and sees with good central and peripheral vision. In early glaucoma, we often find what's called a nasal step. So here again we see the normal blind spot which is supposed to be there, but another area of darkness that isn't supposed to be there. This person has early glaucoma and they have started to get a visual field deficit. That visual field deficit can be incredibly difficult to recognize unless we're doing a visual field test. When glaucoma progresses, the vision loss that's reflected in the peripheral vision test can be greater. Here you see a normal blind spot, but the rest of the field should be light or white as it is down below. Up high you can almost see an arc pattern to the visual field loss. And what's interesting is that we talked about the nasal step being a typical sign of earlier glaucoma. This person has a nasal step as well, but it's become so dense that you can't really pick up the other half of the arc as it curves over into the nasal part of the visual field. So this person had a nasal step which has evolved into what's called an arcuate defect, and that's a classic defect in patients with glaucoma. And finally, when glaucoma progresses to advanced stages, it can leave you with the only part of your visual field remaining as that area of best central vision. We call that a central island. This is a highly constricted visual field test. You can't even tell where the normal blind spot is supposed to be in this eye because there's too many glaucoma defects, too many blind spots from glaucoma throughout this visual field. All that's left for this person to see is an area right in the center. But if we remember our comparative anatomy, this area that remains is sort of like that state of Kansas area, and somewhere where that cross meets is that backyard area that may serve 20/20 vision. And this person, even with so much damage from glaucoma, may still be able to read the eye chart with 20/20 vision. And so if we only tested by using the eye chart, we would really miss a lot of the impact of glaucoma and a lot of progression with glaucoma, which is why the visual field tests are so important. And if you look back at our picture of these two guys, you get some sense of how the visual field test reflects the actual vision, where this patient can only see in the center and everything is dark around the center. So to conclude, the visual field is everything we can see with a stationary eye at a given moment, and the visual field test is our way to measure the visual field. The visual field is divided into the central and the peripheral vision, and we measure the peripheral vision with that visual field test. Glaucoma typically, but not always, affects the peripheral vision before the central vision, causing characteristic defects in the visual field. And that's why we think the visual field test is so important and why we put you all through it so often. So thank you very much. Any questions?